Having acute or chronic kidney disease is not a life sentence. Yes, there are some things as an individual that you can do to help prolong your life and also reduce your frequent visits to the hospital. And that is what I am going to be sharing with you on this particular video. Good day, everyone, and welcome back to Nurses Lecturing YouTube channel. My name is Messi Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you 7 things that you should do to reduce your frequent visits to the hospital as an individual with chronic kidney disease. And these steps are likely going to prolong your existence on Earth. But before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Messi Mary saying thank you. Let's go there. All right, welcome back. Like I earlier said, today we're going to be talking about living with chronic kidney disease. Yes, living with chronic kidney disease, what you should do, 7 things you should do. Well, first of all, I would like to let you know that the kidney is a very important organ in our body. Yes, the kidney serves as a filter in our body. It helps to filter waste product that we don't need out of our body. It helps to filter those toxic substances out of our body and gives our body what it needs. Same way you have a filter, when you filter things, the waste product, you take it out, the shaft, you take it out, the fluid you need, you use it. So that is what the kidney does in our body. And when the kidney is damaged or when the kidney is having issues, this function is impaired. The kidney is unable to filter those wastes. The kidney is unable to carry out that responsibility it is meant to carry out. So that is where you now hear of acute kidney failure, chronic kidney failure, end-stage renal disease, and things like that. But on this video, I'm going to be telling you what you should do if you have been diagnosed of acute or chronic kidney disease. And the first one I want to share with you is lifestyle changes. When it comes to living with CKD, lifestyle changes, it's very paramount. The first thing is that if you smoke, I would advise you stop smoking because smoking generally is not good for our health. Smoking is not good for our health. It predisposes us to a lot of health conditions that I believe you don't want to experience. Okay, so if you smoke, try as much as possible to stop gradually and totally. Or if you are finding it difficult to stop, you can seek some help of those that are expertise in that field to help you out. Same thing applies to alcohol. If you drink alcohol frequently, I would advise you limit the bottles of alcohol you take in your body. Because when you take alcohol, when you smoke, you are overworking the kidney. You are giving the kidney a lot of function. You are giving the kidney a lot of work to do. And when you have CKD, the kidney doesn't have that full capacity to do what it normally did before. Then the third thing when it comes to lifestyle changes I would like to share with you is to take a lot of fruits and veggies rather than all these caffeinated drinks, rather than all this canned food and things like that. Take a lot of fruits, a lot of vegetables. It's very important. Try as much as possible to eat a healthy and a balanced diet because it is very paramount when it comes to those that are having CKD. Then another that is very important is do a lot of exercise. Yes, it's advisable you do a lot of exercise, especially when you have the strength to do it. This is quite different when you have end-stage renal disease, end-stage kidney disease. This is just more or less like if you have a chronic disease, you still have the strength, you still have the energy. Because when you do exercises, it actually boosts your energy, it makes you sleep better, it helps to ward off depression, and it keeps you busy if you do a lot of exercise. And also is very important. There's something I want to share with you when it comes to lifestyle changes, and that is reducing your sodium intake, your salt intake. And you know those food that we buy in the cans, sachet, chips, all those things, they contains a lot of sodium. So you have to do your possible best to reduce sodium intake, because when you don't reduce sodium intake, there's going to be an imbalance in the sodium potassium pump. There's what we call sodium potassium pump in the body. And when that happens, it's likely going to decrease your renal function the more. So if you've been diagnosed of chronic kidney failure, it's advisable you do what? You reduce your sodium intake. Then another is if you are obese, your BMI is high, actually reducing, working on your weight is going to go a long way to improve your renal function. So lose weight, it's very important. Get active. Don't just stay in one place. Don't just restrict yourself. You have to be active. You have to be busy. Do exercise. Carry on with your normal activities as your strength could carry you. Just make sure you're active. Don't be depressed. Don't just sit at home doing nothing. Don't just sit at home doing screen time, watching TV, but you are not active. So if you have that, you just have to keep active and still being active as much as you can. So this is what I have to share with you in regards to lifestyle changes. And that takes us to the second point I want to share with you. The second point I want to share with you is kindly stick to your medication regimen. Whatsoever your medication, your GP, your doctor, your healthcare provider gives you, it's advisable you stick to your medication. For those that are hypertensive, it's advisable you stick to your antihypertensive medication. For those that are diabetic, it's advisable you stick to your diabetic medications. For those that have high cholesterol, it's advisable you stick to the medications too. For those that are having high potassium level, it's advisable for you to stick to your medication, because high potassium level in the body causes muscle weakness, stiffness, and tiredness. If high potassium level is severe, it can lead to irregular heartbeats, which is known as arrhythmia, which can lead to heart attack. So if you're having water retention, your doctors might also prescribe some diuretics. So whatsoever medication regimen your doctor prescribed for you, is advisable you take it. If you stick to this medication, it's definitely going to help with your kidney function and help to prevent frequent and regular visits to your GP or your healthcare practitioner. Then the third one I have to share with you is that follow up with dialysis if your doctor said you have to go for dialysis. Usually, dialysis is for those that have advanced chronic kidney disease. Yes, advanced chronic disease. So keep up with your appointments when it comes to dialysis. Visit the doctors when it comes to dialysis. Make sure you stick to that regimen and make sure you don't create excuses for it. Set up your alarm, set up reminders that helps you remind appointments when it comes to your dialysis treatment. Then the fourth point I have to share with you is that go for frequent reviews and monitoring by your doctor. It's kind of similar for you going for your appointment, your checkup, frequently visiting the doctor to know what is wrong. It's very important. It's good for you to check your vital signs. It's good for you to check your blood pressure if you know you are hypertensive. It's good for you to check your sugar level if you know you are diabetes, because that gives you a clue on what to tell your healthcare provider, and also on how to modify or change your medications if need be. So regular monitoring, regular review by yourself and also by your healthcare practitioner, it's very important. Then that takes me to this fifth point, which I want to share with you, and that is having frequent support, being among your family, those that really care about you, those that understand the condition, those that understand what you are going through, trying to stay around people that are positive, trying to stay around people that cheer you up, trying to stay around people that see the positive side of you, not trying to stay around people that always see the negative side of you, because that might make you depressed, that might make you want to avoid people, that might make you want to avoid contact. But trying to balance your social life, trying to be happy, trying to stay positive, trying to stay focused is going to go a long way to help you improve your lifespan. Having good a positive vibe, having good energy is very good when it comes to your overall health and wellness, because it's actually release the feel good hormones, actually release the good hormones in our body. Then the sixth point I have to share with you is that when it gets to the end stage renal disease, or the one that requires kidney transplant, definitely your doctors are going to let you know and maybe put you on the waiting list for kidney transplant if need be. So they are going to be in the better position to tell you what and what to do. But this is just me giving you the general advice. And before that kidney transplant, the seventh point I want to share with you is that a lot of you out there that take medications, like they take medications without doctor's prescription, it's advisable to speak with your doctor before you take any medications. And also, we all know that NSAID, like a paracetamol and ibuprofen, can be getting over the counters. But for people with chronic kidney disease, it is not advisable for you to take NSAIDs. Yeah, non-steroidal anti-inflammatory drugs. It is not advisable for you to take NSAIDs for your pain. So you can speak to your GP, you can speak to your health provider to give you better options when it comes to pain management, okay? Because NSAIDs are not generally good for the kidney, even for the liver. Okay, so this is what I have to share with you, and I hope it helps. I just want to let you know that having chronic kidney disease is not the end of the world. It's not a life sentence. People have been living with CKD and they are doing fine. People have been living with CKD and they're able to go to the hospital, get their treatments, and do their normal days activities, they exercise. So don't feel, oh, I have been diagnosed of CKD, chronic kidney disease. That is the end of the world for me. I'm going to die soon. I'm going to leave the earth soon. No, all I want you to do is to always stay positive, get that positive energy to always move on and also be happy, be around those that makes you happy. So this is practically or basically what I have to share with you, especially those living with CKD. But I want to let you know that lifestyle modification, lifestyle changes, it's very important. Okay. So thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercenary saying thank you. Bye and see you in our next video.